Hello, I'm Beth Gaddis, the Vice President of Marketing at Patient Prism, and I'm delighted to welcome Christine Taxin to our studios today.
Thank you.
Christine is a medical dental cross-code billing specialist and also the founder of Links to Success. Tell us a little bit about what Links to Success is.
You know, Links to Success was named by my children.
Really?
Because I was trying to find a name, and they said, Ma, you're going to link them to being profitable, successful.
I love that story.
So that's how the name came about, Links to Success. And I started as a consultant and just kind of found my niche. As I saw trends changing, I decided that I was going to change with it. You know, I can't change my age, but I could change my brain.
Well, tell people a little bit about yourself. So you're married to a dentist.
I'm married to a dentist.
You worked in the dental field for a long time.
Very long.
And tell us a little bit about your background.
My background is I actually worked in medical and dental.
Okay.
I worked for the chief of spine surgery at Mount Sinai Hospital. So that's where my medical coding degrees came from. And then, of course, I married a dentist. So
You
where
had to
did
learn
I
that.
go?
Right.
You know, having 5 kids, I needed to be closer to home.
Right.
So we decided I would, you know, run the practice, and we had all specialties in the practice. So that's how I started to say, you know, this should be billed to medical.
Well,
but I didn't jump in yet. I jumped in later.
Well, now you teach medical dental cross-billing to students at Harvard, to students at NYU's dental school, and tell us about some of the other work that you've done.
Well, I've helped set up Detroit Medical Center,
Right.
and they now have an oral surgery and dental department as the oral physicians of the hospital. And there are no patients any longer having surgery without first being seen by the oral physician. They want to make sure there's no active infections, bleeding, or anything before they do surgery on those patients.
Christine, I feel like that's such a big change in how dentists have been viewed in the past. About when did that change start happening?
You know, it started to happen truly at Harvard.
Okay.
Harvard's the first dental school that collaborated with the medical school. So the first 2 years of schooling there, whether you're in the medical department or the dental, they work together, the students.
Oh, I didn't realize that.
So they are being taught together, they're working together, they're doing rounds together at the hospital, and treatment plans are being done together. So the medical doctor will treatment plan and diagnose his part, and then the oral physician will look at, well, this patient is a diabetic.
Right.
And we know that the oral cavity and diabetes can make it worse.
So
if the patient has bleeding in the oral cavity, then that is going to promote more diabetic incidents.
So what I'm hearing is that, you know, the idea of cross-code billing might be something a little unusual to dentists who maybe have been practicing for a long time and office managers who have been running practices for a long time. But new dentists, this is how they're getting trained now.
This is how they're training. In fact, UConn announced that they're going to start this year, following down that path. My son is graduating in Virginia at the dental school next year, and he knows it. And then the thing about this field is my nephew is doing an internship and a fellowship for endocrinology in the medical world, and we all talk together.
Oh, wow, that's great.
About what's going on, and I'm going to be working with him, and you know, he's ready to collaborate. He's going to be out there. He's collaborating.
Well, I'm going to tell you, I mean, honestly, I had a misconception that, you know, cross-billing really was only for specific procedures. I was thinking like dental implants and sleep apnea and maybe ortho, you know, for medical reasons. And that's really as far as I was thinking. But in talking to you, that's not true. That was a misconception that I had.
No, it isn't. You know, even dental insurances, and Beth, a lot of doctors don't know this, but even dental insurances, they're not covering a lot of the surgical procedures. But
Such
what
as?
they do have now...
Such as like bone grafting?
Yeah, like bone grafting is no longer a covered procedure under dental. So it's strictly medical billing.
Okay.
Unless you want to charge the patient. But the benefit of that and what they're compensating for is they've added on wellness benefits. So Cigna, Delta, Blue Cross. If the patient is a diagnosed patient with kidney, diabetes, pregnancy, anything that changes the composition of your body
Right.
and your immune system, you're going to get 2 to 3 additional visits per year for oral cleanings.
And that's what you would need to be billing to the medical side.
You could actually bill that on a lot of the dental plans. That's why they're not paying for some of the surgical.
Okay.
Now, if the patient doesn't have dental, that will be billed to medical. So you have to know to diagnose.
Right.
Whether you're billing dental or medical. So this year, one of the biggest changes is the dental claim form.
Okay, tell me about that.
That's changing in a lot of ways. It already added boxes for diagnostic codes, but now if you want these additional benefits for your patient, you're going to have to diagnose them. So you can't get those benefits without it. So that's number one. And number two, we always traditionally used like shortcuts, abbreviations,
right.
Upper right. UR, lower left, LL.
Right.
Well, now we're going to be using the medical shortcut terminology.
Which is what?
Which is either JP for a tooth number or JO for the oral cavity, where in the oral cavity.
So this can kind of sound scary to some people that might not be used to this.
Yes.
So tell me a little bit about, how do you even start learning about this to see whether or not something that should be getting implemented into your practice?
I start them with their dental codes, and I recommend running a report, dental code by provider.
Okay.
And look at the dental codes you're utilizing before you jump into it.
Okay.
Make sure you're using all the dental codes. And then what are the top dental codes that are you providing? So whether it's implants or x-rays or prophy or scaling and root planing, then I could try to help you see which way we should start.
With crossing over and doing the cross coding.
So if it's a perio office, of course we know the perio.
Right.
If it's a sleep apnea or TMD office, both of those are medical billing.
Okay.
If you're doing oral surgery, you should be doing medical billing. Absolutely. Okay. And then finally, ortho is doing a lot of medical billing because the Affordable Care Act mandated that if a child's oral cavity braces were needed, it was for vertical dimension or different things, not cosmetic, then that would be medical. And a lot of orthodontists started adding a lot more because they buy CBCT scans.
Right.
And that's all medical billing.
Okay, so all of your cone beam.
So all cone beam is medical.
Okay, fantastic.
So it's a lot of changes, So
in some way, it sounds like dentists are doing a lot of the procedures already in their practices that they could be billing to the patient's medical records if they were trained on how to do that.
That's right.
And then that could be an investment that they're making in the training for their practice that they would then be able to recover. And the return on investment is going to be pretty easy to see once they're up and running.
That's right. And then think about the advertising possibilities.
Right.
I mean, that's one of your specialties.
Right.
Think about how that makes their office unique. And don't wait for everybody to graduate. Because they're going to flood the market.
Well, and the other part about this is, for the patient wants to be using all of the benefits that they have available to them, both dental and medical, to help cover the cost of the treatment that they need.
Absolutely.
So it's a huge patient experience benefit to be able to work with their medical insurance as well as their dental insurance.
Well, it's not only that, but I myself are getting emails from patients asking me, do you know a dentist in this area that will bill my medical? My medical doctor said it was billable. Or my friend had it done and it was billed. So I'm going to put a star on our computer, a map of the country, and every doctor's office that takes training is going to have a star, and then patients will be able to search the site for doctors that will be able to do medical billing.
Fantastic. Well, Christine, tell everybody what that website is that they should go to.
That website is dentalmedicalbilling.com. That's where the site will be for patients to even go. And then my regular site is linkstosuccess.biz. So you can find both of my sites online. And I'm open to questions. I learn more from the offices I work with and from the patients that email me than I could possibly learn taking courses that I do.
Well, Christine, thanks so much for joining us today. I really appreciate it.